Welcome, everyone.
This is
Nursing Theorist in Practice.
My name is Charissa Midge Pitogo.
I am Donabel Bentulan.
And I am Juverose Yi.
We are here today to discuss about Imogen King's goal attainment theory.
Do you think you are well acquainted with her theory?
I don't think so. You may have heard about her and her theory, but you haven't really grasped her model.
No need to be disheartened, people, as we are here to help you out.
After this session, you will be able to assess King's credibility as a theorist.
You will be able to define and understand King's conceptual model and theory.
Also, you will be able to distinguish the systems of personal, interpersonal, and social system.
And we can define the meta-paradigms of nursing based on King's theory.
You will be able to incorporate King's theory in different nursing practices.
But most importantly, you will be able to feel empowered in using King's concept.
To start, according to Sherlock and Mesmer, the theory of goal attainment was developed and introduced by Imogen King in the 1960s. She was born in 1923 in Iowa and died in 2007. She received her diploma in nursing in 1945 from St. John's Hospital of Nursing and pursued her bachelor and master's degree at St. Louis University in 1948 and 1958. Furthermore, she continued to pursue her education and got her doctorate from Teachers College in 1961. Imogen King has worked in a variety of staff nursing roles. From 1947 to 1958, she worked as an instructor in medical surgical nursing and assistant director at St. John's Hospital School of Nursing. From 1966 to 1968, she served as an assistant chief of Research Grants Branch, Division of Nursing at the U.S. Department of Health, Education, and Welfare. From 1968 to 1972, she served as the director of the School of Nursing at The Ohio State University in Columbus. In 1972, she was hired as a professor in the Loyola University Graduate Program. She also served from 1978 to 1980 as a coordinator of research in clinical nursing at the Loyola Medical Center Department of Nursing. From 1972 to 1975, King served as a member of the Defense Advisory Committee on Women in the Services for the U.S. Department of Defense, and in 1980, she was appointed as professor at the University of South Florida College of Nursing.
Wow, she was an amazing woman and very active in her profession.
Yeah,
She was. In addition to all that, she was able to publish 3 of her books that helped provide an extended understanding of her conceptual framework. She also received recognitions for her hard work. And girls, you can actually find her works and records online in the archives of Loyola University of Chicago.
Also, according to Fawcett, King developed her goal attainment theory during the time when nurses were still struggling about their profession. It was her intention to help aspiring nurses by providing a framework for nursing actions and furthered her work by developing a middle range theory.
Thus, according to Masters, in conceptualizing her framework, she pondered on questions relating to the scope of nursing practice, the environment and situation where nurses render their care, the trend of nursing goals, and the criteria that gave nursing strength to be a profession. This enabled her to present her framework as an interconnected system that affects individuals, groups, and society in relation to their environment. So now, let's begin to explore King's framework of interacting systems, basing on the books Nursing Theories, The Base for Professional Nursing Practice by George, and Alligood's Nursing Theorist and Their Work by Sherlock and Mesmer. King distinguished the systems of personal, interpersonal, and social as the 3 domains of nursing, which discern humans as the system's primary element.
individuals are referred to as personal systems. Interpersonal systems are described as the interactions between two or more individuals. The last system she identified is a social system, which are formed from the group of people making up the society. Personal systems identify the concepts of body image, growth and development, perception, self, space, and time. Interpersonal systems involves the concepts of communication, interaction, role, stress, and transaction. Social system is associated with concepts comprising of authority, organization, decision-making, status, and power. And by presenting these conceptual systems, she was able to develop her nursing theory of goal attainment as an application to nursing practice.
According to Masters, the theory of goal attainment focuses on the nurse-patient relationship wherein both work together to identify desired objectives, propose, and implement actions to achieve perceived goals. She identified the concepts of influencing a person's ability to attain goals. First is interaction, described by Gunther as the discernible verbal and nonverbal practices made by two or more individuals in mutual presence that is goal-oriented. Second one is perception, refers to how each person sees the actual situation he is in. Communication as the exchange of information between people, as stated by George. Transaction as the interaction between individuals and their surroundings where individuals mutually find behaviors that seeks to reach identified objectives. Role as the expected group of behaviors which relates to the title and position held by a person, including rights and responsibilities linked to that title. And the concept of decision-making described as the action of making choices to achieve established objectives.
Basing on the book Nursing Theories, a framework for professional practice by Masters, King identified and defined the meta-paradigms in her theory. She defined nursing as a process of action, reaction, and interaction by which nurse and client share information about their perception in a nursing situation. Person is described as a personal system that interacts with interpersonal and social systems. In relation to health, she described it as the human's ability to continually adjust to stimuli in the internal and external environment by utilizing resources to reach optimal capacity to live daily. An environment as an external and internal context where humans can maintain health. The interaction between these four elements facilitate goal attainment.
Wow, what a concept!
Is it just me? I think her theory is quite complex.
Well, just to enlighten everyone's mind, why don't we try to look at the theory using the analysis criteria by Chin and Kramer?
According to Chin and Kramer, as cited by Shaloff and Mesmer, the first criterion is clarity, where King defines her concepts clearly. Her use of conceptual system and goal attainment theory were explained and can be easily grasped by nurses. She has a model of transaction that demonstrated a process of human interactions which resulted to transactions. This helps understand the whole idea of her theory as it is self-explanatory and simple.
Next is simplicity. Her definitions are clear and are obtained from previous studies. King's theory of goal attainment presents 10 major concepts, and the concepts are understood easily. The number of elements within each descriptive category and their interrelationships are not minimal. And as for generality, her theory was criticized for only being applicable to areas where patients are capable to interact with the nurse.
The fourth criterion is accessibility.
King believed the theory could be measured and evidence of the effectiveness of nursing care demonstration if nursing students were taught the transactional process in the theory of goal attainment. The last criterion is importance, where King concentrated on the nursing process, assessment, planning, implementation, and evaluation. which are significant for the development of understanding the discipline of nursing.
Now let us take a look in this scenario. Hi,
Hi! How are you?
I'm good. How are
Have a
you?
seat. I'm good. Can I have your name?
Oh, my name is Lolina Smith.
Is that with an S?
Yes.
How about your date of birth?
It's April 1, 1987.
Is this your first time?
Oh no, actually I've been here for a couple of years now.
Oh. So, what can I do for you today?
I have a concern with my medication. I just don't want to use insulin. So, is it possible to just change my lifestyle or change my diet for a few more months?
We can't do that. I mean, you have been stalling your insulin for quite some time. That's why you need to start using it now. Understood?
Oh, really? Is there no other way?
Unfortunately, no. Wait, something's not right about that scenario.
I agree. In that video, the nurse clearly did not use King's theory of goal attainment. She did not even bother to introduce herself to the client.
And on top of that, she also did not show interest about the client's concerns and feelings. And most importantly, the nurse did not help on setting attainable goals. Now, let's watch how the situation should have been handled when applying King's theory of goal attainment. Hello, Mrs. Mondragon.
Hi, Nurse Daniela.
Have a seat. How are you?
Thank you. I'm good. Thanks. How are you?
I'm pretty good as well. Thank you for asking. So, just for verification, may I have your name, please?
Romina Mondragon.
Alright, yes. And how about your date of birth?
It's April 1, 1987.
Alright, thank you for that. So, it's been a long time since you've been here,
Yeah,
and you still haven't started your insulin.
I know.
What's wrong?
Well, I actually don't want to start insulin, so is it possible if I can just change my lifestyle or my diet again for a few more months?
Oh, Mrs. Mondragon, I'm terribly sorry. I know it's hard, but we can't do that now.
Oh, okay.
You've been showing symptoms of complications because of your diabetes. It is important that you start using your insulin to prevent worsening of your condition. I'm sorry. So why don't we talk about your concerns? We're not starting it.
Well, honestly, I'm afraid of the needles and I am confused of how I perform the injection by myself.
Oh, I see. So you're afraid. Well, about that, don't worry, okay? As I will be teaching you in doing the injections. I will also provide you with leaflets that will guide you on your site injections, rotations, and sterility. So I will be with you when you do your medication for insulin. But if you are still not confident in doing it, I can refer you to a diabetic center that can provide further treatment plans that you can do.
Okay. Thank you for that, Nurse Daniela.
You're welcome. So, is there anything else?
Well, is it alright if I think about it more and discuss it with my husband?
Of course you can, no problem at all. And if possible, you can bring your husband with you next time, alright?
Okay.
So we can discuss this together and help you start your medication as soon as possible.
Okay, thank you so much.
You're welcome, okay?
Okay.
Have a nice day.
You too.
Bye.
In the second clip, the nurse took her time to recognize the client's emotions and concerns.
And most importantly, the nurse helped the client set attainable goals.
In conclusion, the key aspect of King's theory is the congruency of the nurse and patient's perceptions, judgments, and actions, directing to goal-related transactions. When nurses equipped with knowledge and skills interact and communicate appropriate information to the patient, mutual goal setting and attainment occurs.